Doctor, what are polyps in the large intestine and what causes it?
Okay. Polyps means basically a mass-like structure which is protruding into the lumen of the intestinal tract.
Okay.
So it is caused by various reasons. One is because of our food intake. If one excessively consumes animal fat, that can cause polyps.
Okay.
And lack of fiber diet. These are the two causes externally. And internally they have the genetic predisposition. Means one body have the tendency to form the polyps. So there are two types of polyps. One is adenomatous polyps and other is juvenile polyps. Juvenile polyps are basically seen in small children, like say 8 to 10 years or 4 to 10 years group.
Okay.
They cause pain while defecation and sometimes bleeding in the stools.
Okay.
And mucus in the stools.
Okay.
So this is seen in young children. And in elderly, because as I said, they have genetic predisposition as well as bad lifestyle related changes, they can be seen.
Okay.
And what is the implications of polyps means sometimes the benign polyp can change into cancerous polyp. So when we do a colonoscopy, we see the polyp, we take a small piece of it called biopsy and check whether is there any tendency for progressing it towards the cancerous change.
Cancerous change.
So depending on that, we can remove with the colonoscopy itself without doing for surgery. So that is one of the important management aspect where we can remove minimal invasive technique.
So if you catch it at an early stage, it's very simple and the procedure is just a colonoscopy is enough to remove the polyps.